Welcome to the Unstuck Podcast. I'm your host, Sean Miner. This weekly no-fluff mindset show arms you with the practical tools you need to get unstuck so you can get exactly what you want out of life. Remember, when you change your mind, your life will follow. Let's get into today's episode. Hey there, friends. Thanks for joining me on this very special episode of Unstuck. Happy to have you here, whether it's your first episode or you've listened to all 35 episodes now. I appreciate every single one of you for being here. Today is, like I said, very special because I am interviewing my very own personal acupuncturist, someone I have been seeing regularly. She knows everything about me and my health issues and all that stuff for years. And I was able to sit down with her and talk about some of her past struggles and how acupuncture helped her get out of being medicated for depression, and has really been a huge tool in her own life, but then of course has become her life's purpose. So we're going to get into that in just a moment. First, I just want to give you a quick, brief reminder that we are currently accepting the founding members of the Unstuck Collective, my brand new monthly membership. We are actually very close to selling out. So if that's something that you are interested in, get on it, sister. I'll see you inside. Head to seanminer.com/collective. You can learn more. You can also go to episode 33 and 34 of the Unstuck podcast and listen to the first 15-ish minutes of each to hear in my own words what we will be doing over there, answering all the frequently asked questions. We'll do it all over on those episodes, or you can head to the webpage. I am beyond excited to connect with you all on a much deeper level and to create this community of friends and high vibe people and our safe place to go where we will never be too woo-woo, too weird, too positive, whatever you've been told. When you've been practicing everything we do here on Unstuck, it will be all good over there because you will be with your like-minded friends. Head to seanminer.com/collective to save your seat for the founding members. The next time this will open will not be for several months. So if you want to get in, do it now. That's all I'll say. All right, let's chat with my personal acupuncturist, Dr. Caitlin Gordon. She is a doctor of acupuncture and certified functional medicine practitioner based out of Boulder, Colorado. She specializes in mental and emotional health because symptoms related to these are just a sign that something is out of balance and needs attention. Acupuncture played a vital role in her own journey with both anxiety and bouts of depression and helped her become drug-free and find resilience towards life stressors. She has been absolutely amazing and influential in my own healing journey. I originally started seeing her back when I was dealing with mold illness, so she has helped me with a detox, with weight loss resistance, hair loss, stress, sleep issues, inflammation, immune system issues. Even if I go in with like a pain in my hip, she works on that. It has been an absolutely phenomenal person to have as part of my holistic wellness team. And I cannot imagine going through a healing journey without her or without acupuncture. I'm such a huge fan, but to be honest, never really knew what was going on in those sessions. So that is why I wanted to have her on the show to explain what actually is going on with acupuncture treatments. Why do we feel so good when we leave, even though we just had a bunch of needles sticking out of us? What is the magic that happens in acupuncture. To learn more about Dr. Kate and everything she stands for when it comes to mental, emotional, physical, and energetic health, you can head to her website, amalunawellness.com, or her Instagram at acu.kate. That's acu.caite. And I will link all of that up in the show notes. So without further ado, let's hear from Dr. Kate. Dr. Kate, thank you so much for coming on the Unstuck podcast today.
Yay, I'm so glad to be here.
I'm very excited to have you here, and even better, to do it in person.
Yes.
I was just saying, I think this is like my first time ever actually visually being in the, talking to someone, being in the same room, sharing the same energy.
Yeah.
It's so fun.
It's
I
special.
love it.
I haven't done this before in person either.
Yeah, well, this is a first for both of us, but I'm excited to introduce you to my audience because, I've known you and have been seeing you quite regularly for a very long time. I think it's been over 2 years that I've been coming at least once a month to see you and to get some acupuncture and some treatments done from you. And I absolutely love it. And, I have to be totally honest. I think you know this about me. I don't really know what I'm doing when I'm here. I know that I get a really good nap, and I know that I feel amazing when I leave, and whatever ailments I'm going through at the time, and I've gone through quite a few in the 2 years that we've been working together, they kind of go away afterwards. So I know that there is some magic that happens here when I come to acupuncture, but I don't really know what's going on, and I don't think I'm the only one out there that feels that way.
Yeah, I agree. I think that's a very common experience where you just trust that something's working, but you don't actually understand how or why.
Yeah, especially when it comes to kind of this like energy medicine and just, working with something that you can't visually see. And I think that's really hard for humans to wrap their heads around. So I'm really excited to dive into that. But first, I want to just give you the chance to introduce yourself to everyone out there and tell us who you are and how you got to where you are today.
Ooh, okay. What's the brief version of that?
Yeah, I could go on for days, I'm sure.
Could go on for a while. I practice acupuncture and functional medicine, and I have a clinic in Boulder and also work with patients via phone consultations. And I got into acupuncture because I was having pretty severe insomnia and anxiety when I was in undergrad. And at that point had been medicated for several things. I was being medicated for ADHD and for depression. And my psychiatrist, of course, then wanted to put me on sleeping pills when I was having anxiety and issues with sleep and or anti-anxiety meds. And I just felt like I'm not even 21. Like, this is too young to be this medicated. There has to be another option. So really out of desperation, I went and saw an acupuncturist here in Boulder. And it was so transformative for me on many levels. And essentially, I was just inspired to do what she does. I was on track to start law school and had an epiphany one day. Truly, I woke up and was like, I think I'm making a mistake. I actually want to do what my acupuncturist does. Like, how do I make that happen? And then the next week enrolled in grad school for Chinese medicine.
Wow, that was a quick transition.
It was, yeah.
So the epiphany, because I think that happens to a lot of us, and I think that there are certain people who take it and roll with it and make it happen like you did in a matter of a week, and then there are others that ignore it and they continue to go on this path. Like you going to law school, you obviously would have been unhappy, totally down the wrong path for what you were supposed to do here.
Yeah.
So what did that feel like, and how did you know to take that route?
Yeah, I get asked this a lot because I think everyone sort of wants to have those moments in their life where something's really clear and then they realize that they need to take a different path. And it honestly felt like divine intervention. I don't know how else to describe it. I just had a very clear knowing that if I chose to start law school, that I was going to be putting energy into qualities of my personality that were going to cause more stress, and that I was going to be creating a life that was going to be more stressful. And that awareness and the kind of little excitement that I felt around imagining a different type of lifestyle motivated me to do some research. And once I realized that for a similar amount of time investment and less money, I could get a degree in Chinese medicine. It just felt like, why wouldn't I follow my heart?
Mm-hmm. What was it that drew you to law in the first place? Was it kind of this story you had been telling yourself, or someone else had told you growing up? Like, why was that the path?
Yeah, it was a combination of both. So I'd been told that I had certain personality traits that would make me a good lawyer. Like, I was very good at debating, and I was sort of relentless, and I had this drive and ambition, and like I was very academically successful. And so all of those things, people would always tell me growing up, oh, you'd make a great lawyer. And there were a lot of lawyers in my family. So all of that definitely played in. But the type of law that I wanted to do, I really wanted to do international human rights law. So I was really driven by a desire to serve. And I wanted to relieve suffering. I wanted to help. I was really impacted traveling a lot in my early 20s by just being in third world countries and the amount of suffering happening there. And I wanted to make a difference. So the core desire to be of service has remained the same, but I just realized there was a different path that would probably be more fulfilling for me to do that.
Yeah, for sure. Now let's go back, because you mentioned your own kind of mental and emotional health struggles. And I know that has been something that you now carry into your practice here, and it's something that you specialize in. So let's go back to when that started for you. Was it an early age thing that happened?
Yeah. When did it start for me? I think similarly to a lot of people who identify as having anxiety or depression, oftentimes I'll ask patients of mine, well, when did it start? And they say, well, like, I've always been this way. And while I never identified as being anxious growing up, in retrospect, I certainly was. And so I would say high school is when it became to a point where it was impacting sort of how I functioned. And then it wasn't until college that I had anyone officially diagnose me, which I still, I take issue with that whole system and the way we diagnose mental health issues. But that was the first time someone gave it a label.
How was it diagnosed?
I went to a psychiatrist after I got back from study abroad my sophomore year of undergrad, and was describing just feeling lethargic and unmotivated, and like nothing that I usually enjoyed brought me any pleasure. And she goes, "Oh, you're depressed." And then I was like, "Oh, I'm depressed."
Yeah. Like, that's as far as it went. It was like a few sentences of your symptoms, and that's it.
And that was it. Yep. Which is how most psychiatrists operate, is, their job is to prescribe medication.
Yeah.
And you don't have to say much to be a candidate for antidepressants these days. They'll prescribe them for pretty much anything, for PMS, for digestive issues, for sleep issues, for anxiety. I mean,
it's just, they are handing them out pretty regularly. And I think we both know, as being people in this holistic health space, how damaging they are for the human body and for our health. But even just, it's still putting a Band-Aid on something instead of addressing the root cause. Was that the case for you?
Yeah, definitely. It's kind of funny, because I think I was depressed, but I think I was circumstantially depressed because I'd just been traveling on study abroad for 4 months, and I'd come home, and it's that sort of come down that happens after a lot of stimulation, which is totally natural. And it would have been helpful to have someone who could see the bigger picture and go, hey, this is going to pass and it's okay, and you're just integrating and processing, instead of putting me on meds and creating a whole story that then I attached to around I'm someone with depression.
Yeah, and you were put on medication, right?
And I was put on medication, yeah.
And how did that go? How did that feel?
The medication, I was put on Wellbutrin, which is, of all the antidepressants, the most stimulating. It's the stimulant. So it definitely improved my energy level and suppressed my appetite, which as a 21-year-old, I was like, great, like I don't want to eat and I have energy. And so that was a slippery slope. I think I stayed on it for 3 years, and then it was after starting to see my acupuncturist that I started to question the story that I attached to around depression. And since I was feeling pretty good emotionally getting acupuncture, I thought, well, let's see what I feel like coming off this. And then and did that. Actually, I didn't even wean off. I just stopped one day. And I was totally fine. I never noticed a difference.
Oh, wow.
Which is not everyone's experience.
Right.
But that was my experience.
And so do you think then having that transition of kind of both the medication and acupuncture was the reason why it was easy for you to make that transition?
Yeah, I think it was. I think there was a few things that made it easy. Having acupuncture absolutely helped. I felt supported. I also didn't have, I didn't know that some people really struggled to come off them. So I didn't have that story.
Yeah, right.
And so wasn't anticipating it being hard. And that really helps.
Mm-hmm.
And then it's true too that of all the antidepressants, Wellbutrin does tend to be easier to come off of. So there's something chemically about that that's different. And I hadn't been on it for too long. The longer you're on something, the harder it can potentially be to come off.
Mm-hmm. True. That's so interesting. I mean, I think it fascinates me how quickly you can be put on a medication that's, a serious medication. It really does do a lot of things to the body and the mind. How quickly you can get put on that and, not even when you are actually dealing with that thing. And I think that that's obviously really common in Western medicine today. We see that a lot. But for me, it's like almost scary to think how many women are potentially on something that is doing more harm than good, and they don't actually need to be on this. Is it something you see in your practice a lot?
Yeah, and I agree. I'm so passionate about the same issue. People are so inappropriately medicated.
Yeah.
Both over-medicated and medicated for the wrong thing. Inappropriate med for the condition. And again, I think part of the harm, in addition to the fact that anytime you put a chemical into your system, it's not just the impact of the chemical that you are contending with, it's the way that your body is going to respond to that chemical. Your brain is always trying to create homeostasis. So when you put something that impacts brain chemistry, your brain is trying to balance out in response to that. Mm-hmm. So when you take it away, it's not just now the chemical is not in your system, it's now all of that brain circuitry and all that biochemistry in your brain has adapted to having something there every day that's not there anymore. Mm-hmm. And that's what takes a long time for some people to rebalance. So to do that without it being absolutely necessary, and there's very rare instances where I feel like it's absolutely necessary, it's a big risk.
Mm-hmm. So true. It's so true. So what, if you have someone coming in to see you that has basically the same thing that you said to your doctor, your psychologist or psychiatrist, whoever it was back then, what would your approach be?
Yeah, I feel like I'm able to take a more bird's eye view of mental and emotional health these days and understand that having episodes of depression or anxiety in response to major life changes is normal. Mm-hmm. And so normalizing that for my patients. If you're going through a divorce, if you just lost someone you love, if you changed jobs, if you moved cities, there's so many things. All of those kind of transitions are normal times to have it feel like your mood has changed dramatically. And it might be that you feel more anxious or more depressed for up to 6 months, and I would still call that normal. Mm-hmm. And certainly what I'm looking at is how do we support you? How do we help you feel resourced? But we don't need to do that with pharmaceuticals. There's so many other options.
I think just you saying that is normal to have changes in your mood helps so many women. It's like a sigh of relief. Mm-hmm. It's okay to not be okay all the time.
Yeah.
And to feel these changes, you want to be happy, but you're just not. And it could even be at times when you should be happy, like you moved to this new city or this new home, or you had a baby or something like that, and you end up having these changes in emotion that don't feel normal. I just think you saying that already made people feel so much better. And then I think it's more so just about having tools to get you through that time, to make you feel, like you said, supported, and just get you into a place where you do feel more comfortable having those emotions.
Yes.
And is that what now I'm assuming you're kind of in that place yourself, as we all are. And what do you go to make you feel a little better?
Yeah, absolutely. This reminds me of, I don't know who originally said this, but someone was defining stress as the experience of of the external pressure being greater than your internal resources. And so when you feel stressed, what you need is to bolster your internal resources, because the external pressures, it's like that's always going to be there. And so when those increase for whatever reason, good, bad, neutral, then yeah, internally resourcing is where we want to go. For me, there's been a few things that have been hugely impactful in terms of helping me feel like I can withstand more external pressure than ever before, which also to me, like that's the definition of resilience. And we're always going for that. How do we feel so internally resourced that our capacity for external stressors just keeps increasing? And meditation and acupuncture have definitely been the two things that have helped me most personally. That and time outside, honestly, is I'm realizing that I really need to like time outside in nature to feel grounded and balanced in my life. It's so resourcing for me. But I still get acupuncture at least every other week, and I meditate every single day, twice a day.
Yeah, you have a pretty strong meditation practice. You actually learned a specific type of meditation, right?
Yeah, I did. I learned a type of meditation it's similar to TM, to transcendental meditation, but it's called Vedic meditation. And I did learn that through a teacher, and it really helped me adopt a regular practice, which for years I had struggled to do. I mean, I was one of those people who kept trying to meditate and it would never stick. So it feels like a huge milestone in my life that I've been able to have that be part of my self-care habits now.
And you feel a huge, tremendous
I feel a huge
difference. I'm sure.
Yeah.
As we all do when we get into that practice.
Absolutely. Yeah. I like to joke with my patients that a lot of my patients wouldn't need me if they had a regular meditation practice. Yeah. I would become irrelevant, which so I would be happy about.
Me too, actually. That's so true for me too. That's very interesting. Yeah, but I mean, for some reason, it is something that is very hard for people to fully embrace and adopt. I think it has something to do with, not feeling like you have the time, which I'm always like, when you actually get through meditation and you make that a part of your regular practice, your day, it opens up time because you're so much more involved and present in your actual day that you get more done in less time, and you're not spending your time flitting all over in your mind.
Totally.
So like that kind of goes out the window. So then I think it's more of just either feeling like they're not doing it right, or they're not good at it, or it's not working.
Yep. All
of these things, and they're all just stories.
Yes.
But then when you actually realize that none of that even really matters, whatever you're telling yourself doesn't matter. If you still just sit and practice, it makes such a big difference. That's so cool. All right. So now I really want to dive into acupuncture. So first, give us like the general 101 overview. If there was someone coming in your door right now being like, what do you even do here? Tell us that.
Yes. So at its core, acupuncture is helping mobilize your own body's healing capacity. And we do that essentially by putting your nervous system into a state of rest and digest, into that parasympathetic mode. And when we do that, your brilliant, brilliant body self-heals. So that's the basic level. Acupuncture needles, they stimulate different parts of the peripheral nervous system, which communicates with the central nervous system and then impacts the brain. So by working with the nervous system pathways, that's how we're able to transition your body into that parasympathetic state. And that's where all the magic happens.
And that's why you feel so good when you're here and when you're done.
Yeah, that's why you get that nice euphoric, like
little
buzzy.
Yeah, I mean, we call it AccuStoned, right?
AccuStoned,
like when it just you feel so good.
Totally.
Because you're finally in that parasympathetic mode, that rest and digest mode that for most of us is really hard to find on our own in today's world.
Yes. And I think that's where I see so much of the benefit of getting acupuncture is if you're someone, and people who struggle to meditate are a perfect example. If you're someone who struggles to get yourself into that mode on your own, then coming somewhere where you get to be passive and just lay down and have something happen that sort of overrides your own fight or flight response and receive and be put into that state, you develop that neural pathway, which then we can keep reinforcing. And then once you know what that feels like, we're essentially creating the muscle memory in your brain of how to do that in your own life outside of acupuncture.
Mm-hmm. Yeah. So that's why you probably have people come quite often at the beginning of, starting their acupuncture practice. And then from there, it can be more spread out because the body can start kind of practicing that on its own.
Yeah, exactly. We try and create that new groove, that new neural pathway by repetition early on, and then you will maintain that state on your own more easily, and you can spread treatments out later on.
Mm-hmm.
Absolutely, that's the goal.
Yeah. So when you're doing acupuncture, and I know this because I've had a lot of sessions with you, we first start and we talk about the issues. And for me, it's usually I'm not sleeping well, I'm stressed out, something along those lines. Something might be off with my period, who knows? But usually those are the complaints that I have. And so it's really important, though, for you to know what that person is dealing with at that time as far as symptoms, because then you're treating that patient differently and you're putting needles into different spots that on the surface to the average person is like, why is she putting a needle in my toe? It doesn't make sense. I didn't complain about my toe. But you have a pattern that you're following for people's symptoms or what they're experiencing. So what is that pattern? How does that even come about?
Yeah. So Chinese medicine diagnosis is all based on recognizing patterns of symptoms, and it's not like a set sort of, it's not like there's 20 patterns and we put you into one and then we do the same points every time. But based on what you're experiencing, your symptoms, and based on other cues that I get from your system in terms of things like your skin, your energy level, the tone of your voice, what your pulse feels like, tongue, all these things we use for diagnosis, all of that helps me put into a pattern which organ systems, which channels seem like they're in excess or in deficiency. And based on that information, I'm putting points where I want to redirect energy. So the areas that are deficient, I want to redirect energy from the excess areas to those. I'm trying to create balance. And acupuncture points themselves, there's over 400 points to choose from, and every single session's different. And so I just kind of pull from my log of, I know different points help different patterns and different types of symptoms, and so I'm treating the pattern with a unique set of points each time. But in terms of how physiologically, like why something in your toe would potentially help, something related to your sleep, if they do fMRI studies where they're looking at activity in the brain when they stimulate different acupuncture points, we know that certain points in different parts of the body light up different parts of the brain. So for example, there's a point on the foot that's in Chinese medicine we use for patterns related to vision symptoms. And on fMRI imaging, when you stimulate that point with a needle, it lights up the visual cortex of the brain. So for what somehow magically the ancient Chinese had figured all this out without having that kind of technology. And now we have the technology to see those connections.
That is so fascinating.
It's really cool.
And so the use of the needles is to kind of stimulate that energy. And I think obviously a huge kind of, block that people have with acupuncture is with the needles.
Yes.
But they don't hurt.
No.
You don't really even feel it, just maybe a little prick. But how do you get people past that hump?
I mean, people have to want to come in, right? So everyone is having to overcome their own resistance at that level enough to be like, all right, I'm going to be brave and try it. And once you've gone and gotten your first session, assuming you're with someone good, and I will say acupuncturists are a bit like therapists in that the fit is important. And so if you go to someone and you don't have a good experience, that's not how all acupuncture is. You might need to try 2 or 3 people to find someone that you feel comfortable with. But yeah, I treat tons of people with needle anxiety because I treat a lot of anxiety, and my anxiety patients are anxious about coming in. And it's amazing to me how quickly after the first needle insertion, someone just exhales and goes, oh, that's it. It's really so much less painful than the story that we create before we've ever had it.
Mm-hmm.
It's a really relaxing, as you know, experience.
It really, really is. And it really does not hurt at all.
No.
So, okay, let's talk about these people that come in with anxiety or maybe some other mood issue. Maybe it's stress, something. Is there a typical pattern with those people that you see?
In Chinese medicine, there's probably 5 or 6 base patterns that I see with anxiety versus depression. And that being said, looking at it from the perspective of the nervous system, anytime someone comes in who's high anxiety, we're working with the fact that the limbic system of the brain is overactive. So that part of the brain that registers threat is registering threat too often and registering threat in things that aren't threats. So certainly with anxiety, I'm always working on treating a pattern of essentially of hypervigilance of the limbic system overactivation. And we do that through lots of, points in Chinese medicine that help, again, turn on that parasympathetic response. And with depression's a little more complex because with depression, there's always an element of stagnation, of energy stagnation, something stuck.
Mm-hmm.
And to get to a point where we feel depressed, we've had to disconnect on some level from ourselves. And so when we have that disconnection between us and our feelings, us and our desires, us and whatever we're disconnecting from, that creates blockages in energy. So those patients, the approach is different. Oftentimes then I'm trying to actually stimulate more blood flow and more activity and move energy.
Yeah, so I really love talking about this idea. And this was a topic I discussed way early on in the podcast, is how stuck energy then moves into becoming like physical symptoms. Like
Yes.
you have energy, your body is made up of energy, and it can quite easily get kind of like mucked up, and
Yeah.
it can get stuck throughout your entire body and your entire system, and it will cause physical symptoms where you're going to the doctor or even seeing a nutritionist or something like that to try to get rid of these symptoms and to get healthy and balanced again, but you're still ignoring energy, like energy work and energy healing and getting that flow moving again in your body. And obviously, I'm assuming that's a huge piece of what's going on here in your practice.
Yes,
And
definitely.
like, I just think it's something that like we're not considering, we're not even thinking about. And so we keep moving to, let me try this healing diet, let me take these supplements, let me do this kind of testing with my doctor to figure out what's going on, when really it's just because you're super disconnected. And I love that you brought that up, of it's just like when you disconnect from, whether it's like an emotion you don't want to feel or just like a dream you've decided you can't achieve.
Mm-hmm.
When you're just disconnected with yourself, your true self, then energy gets stuck.
Yes.
And then we have issues.
Yep. Yeah, you said that so beautifully. So much of what I'm treating here is that more kind of psycho-spiritual level stuff. And even though, I'm not doing any kind of psychotherapy with people, I am hoping that by reconnecting people with their physical body and sensations and helping calm down the sort of overactive part of their brain or wake up the sort of sleeping part of their brain, that I'm helping people reconnect, because essentially that is what helps us heal. And you're correct that anytime we repress, suppress, disconnect, all these ways in which we sort of resist feeling or resist doing what we need to do when we know, we create disease in the body, which disease, that word is lack of ease, dis-ease. And I have yet to see any kind of chronic condition that didn't have a major emotional component, was not rooted fully in emotional distress.
I'm so happy that you said that. It's so true.
Yeah.
But I think, traditional Western medicine isn't going there, but, not trained to, so that's fine. But we also, I think, as humans almost don't want to go there either, because it's kind of not fun sometimes to actually have to, dig through your thoughts and understand your emotions and get back in touch with something that you've buried and you don't want to express or see in yourself. So I think we kind of will always want to go towards like, let me just try the diet. Like for some reason, taking out more foods is easier than just like, what's going on with me, emotionally and mentally right now.
Absolutely. I see this, as I'm sure you can imagine, so often people come in and, let's say their issue is like chronic digestive issues and they think that if they just figure out the one food that's making them sick, it's going to go away, or they think if we get them on the right supplement, it's going to get better. And all the while they're in a job that they absolutely despise and they're not willing to hear that that's potentially making them sick. And then they quit the job and everything gets better.
So much.
So
like just even like get out of the relationship or
right, whatever the thing is.
The thing.
Yeah.
There's a thing.
There's a thing. Totally. Right. The the parent that you need to forgive, whatever.
Like something from 30 years ago.
Yep.
That you're still holding on to. It's so fascinating to me to see that because, and I think you probably see this a lot, it's like immediate relief.
Yes. Because you immediately free up the energy when you stop resisting the thing.
Yeah, it's so fascinating. Oh, I love it so much. So acupuncture obviously is a huge piece to that puzzle. What else? Because you also practice functional medicine. You also have a sauna in your office, which is amazing. Yeah. So you have other modalities that you use with your patients to kind of give a nice balance of all the things that they could be doing, because sometimes it does also take functional medicine and it does take supplements and it does take dietary modifications.
Yeah. There's situations, it's a two-way street. So there's situations where someone comes in depressed and it's because, something related to, they're really unhappy in some area of their life and they're not addressing it, right? And that's creating depression. They're resisting that they need to do something different with their life and in order to stay in the relationship or to stay in the job or to stay in the family dynamic, in order to kind of stay in whatever is dysfunctional, they've disconnected, and that's creating depression. So that's like an emotional root cause. And then occasionally there's physiological or nutritional root causes. So, they got food poisoning while they were traveling and, created some microbiome imbalance, and they happen to be really zinc or magnesium deficient. And then when we correct those things, they're 60 to 80% better. So I always want to tackle both directions. I think that it may be, for one person, it might be 60% emotional root cause, 40% physiological, or it could be 90-10 or the other way around. It's so unique. But I want to make sure we're not missing pieces. And sometimes getting someone a little bit of relief through, changes to how they're eating or how much they're moving or supplements and herbs gets them to the point where then they have the resources to do the potentially harder emotional work.
Yes. It's like they just need to get a little bit
like a foothold or feel a
little better.
Yeah.
Yeah. So in a perfect world, obviously acupuncture is going to be a staple for someone, because I think right now people are like, yeah, I'm that girl that has the stuck energy. I can see it now. I've been chasing after this like joint pain or something for 20 years and I know I have some forgiveness I need to go through or something like that. So I think acupuncture is obviously a great place to start, but then do you also recommend people do have a therapist or someone to talk to or some other modality to go through, or can they just talk to their acupuncturist and get some needles and go through it that way?
Yeah, it's unique to each person. So I find that we often will get faster results when we're using all of our tools. So if people have the resources, both time and monetary, to do both. When I refer to talk therapy, I'm really specific about it needing to be somatic based. So I don't refer to any kind of talk therapy that's just talking. So if your therapist isn't asking you where you feel emotions in your body, that's not the kind of therapy I'm going to send you to. And that's just from what I understand about neuroscience and how the body works. We need to actually be creating those connections. Otherwise, we're actually reinforcing neural pathways of trauma when we're just talking about what's stressful.
So true.
So I love when people do acupuncture along with somatic-based talk therapies, because they both reinforce each other. We're helping create those new neural pathways and new stories all at the same time, and it's really powerful. And that being said, I have lots of patients who have no interest in doing that, and they still get incredible results without.
Mm-hmm. Yeah. Okay. So it just kind of depends on the person.
Yeah, it's not necessary, but it certainly can speed things up.
Yeah. Okay.
Yeah.
So now, obviously, we have people all over the world who are interested in acupuncture. What do you recommend looking for in a good acupuncturist?
Ooh, okay. So worldwide, the standards are so different in other places that I'm not going to be able to speak to that other than to say you want to feel safe and comfortable with whoever you're seeing for healthcare. I mean, that's true across the board. You want to feel like this person is professional and has good boundaries, is compassionate, listens to you, and is taking a broad enough perspective that they're not kind of projecting their own story onto your health situation, that they're valuing your input and your experience. And ideally, in the US, you'd have someone who's NCCAOM certified. That's the board certification here in the US, and it means that they're licensed and they've kept up on continuing education and they've done all their clean needle technique. So that's the standard for US acupuncturists in terms of the bare minimum.
And something I really love about you, which probably I don't know if everyone cares or not, but for me, when I come in here, I feel like I'm in the most zen place ever, like just how everything's decorated. Like you may even hear water in the background on this podcast because there's a little fountain, going, and it just feels so lovely. It's like I don't even need the needles to get into parasympathetic mode in here. And I think for me, that's really important. And I think a lot of your patients feel the same way, to have this like really nice home away from home to get this treatment. So I think that's something I personally really love. And if you're in Boulder, of course, or even in Denver, I'm sure you have patients that come up from Denver, then you'll definitely want to get in touch with Dr. Kate, and we'll put all of her information in the show notes. But I want to end just you chatting a little bit about where you are working on getting more unstuck in your life right now.
Okay.
I'm sure there's probably some. We all have some things, right?
Totally. What do I want to share about? One of the things that seems to be trending this year around the new year is to pick a word, an intention word for the year. And I like this. So the last couple of years I've done it. And for 2020, the word that I picked was surrender.
It's a powerful word.
It is. And for me, that's an invitation to release control, to be in a state of trust more often, to find the path of least resistance, and to essentially just invite things to be easier. So to me, all of that is areas where I get stuck is when I have the story that things I want have to be hard to get, that, that controlling something is going to positively influence the outcome, that it's kind of all of these mechanisms of essentially anxiety that we glamorize. And so for this year, that's been my practice, is how do I just kind of relax into letting life unfold with less of my kind of intellectual analytical influence.
Yeah. So how has it been going?
My experience has been the universe will give you exactly what you ask for, especially when you're clear. So I've had a lot
Thank you. That's what I've been saying in every episode.
Yes, I 100% believe this. And it's been true for me already. I've had a few things happen already this year that have been really challenging and have absolutely asked me to surrender because there was no other option. Things beyond my control that were tragic and heartbreaking. And so I've gotten a lot of opportunities to practice feeling my feelings and letting go of my agenda and just taking care of myself on a day-to-day basis without being able to plan and structure the way that I would like to with my type A personality. And so far, it's been really beautiful. It's been a really softening, opening experience.
Yeah. So you asked for the chances to surrender and to practice that. So now you're kind of building that practice in your life, that ability. You're making it more accessible and more of a habit for you. Because
Yeah.
obviously before, the reverse is a habit, the efforting and the forcing things to happen and trying.
Right.
And so now the opposite is there.
Yes.
Oh, that's so great. I'm trying to do that too. And it's a challenge. But if
Totally.
truly, when you do, that's when things open up.
It is. Yeah. It's like,
so
how do
fascinating.
you accept exactly how things are? And
without needing to change it right this very second.
right. Yep. Exactly. Like that energy of acceptance. There's so much free flow of energy that comes through when we can get to that place.
Oh, I love it so much. Okay, now last thing, tell people a little bit more, if you do consults over the phone, or is it over Skype, or what is that?
I do phone, mainly because there's weird legal stuff with like privacy when we do video calls.
That makes sense.
But I do phone consultations for functional medicine, and yeah, you can book those through the website. It's a really in-depth look at all of the physical, emotional, spiritual factors that are impacting whatever's going on with you, and how do we free up resources for you to get unstuck.
Yeah, I think that's really important, and really something that I don't think all functional medicine practitioners are approaching. Is like, yeah, we'll look at your hormones, we'll see what your cortisol is doing, what your gut's doing, and we can support those. But then also, what do you need support with emotionally, mentally, spiritually, to make this a full-on healing session and not just looking at those factors. So I think that's really super important and something that we all need. So thank you for providing that to everyone. And we'll, of course, link all of that. We'll have access to everything that you do. And you have a blog and good stuff too. And you always post really awesome stuff over on Instagram. So what's your handle there?
My Instagram handle is acu, Kate, Caite.
Yay. Thank you, Dr. Kate, for coming on the show.
Much.
So fun.
It's been amazing.
Such a good conversation, and we'll chat soon.